Hi, my name is Christoph Smith. I'm a physiotherapist in Stellenbosch, and I'm very passionate about treating and finding solutions for running injuries and chronic injuries. Unfortunately, many of these injuries are caused by long hours of sitting, and I often use the simple squat and variations of the squat to treat and help patients solve the symptoms related to long hours of sitting. So I'm going to show you variations of squatting. First of all, to squat for mobility. There's a lot of stiffness related to long hours of sitting. To squat for posture, and to squat for strength. And there are just different focus areas when we do these three variations of the squat that I'm going to show you that I just use in my practice a lot. I also just would recommend that if you have pain while performing any of these movements, it's a good idea to see a physiotherapist or another relevant medical professional. I'm also at the end of the video going to show you a couple of little warm-up exercises for specific joints to make the squat a little bit easier. So let's start off with doing the squat for mobility. So obviously the squat for mobility is for trying to loosen up the various joint areas affected by the squat, which is around the pelvis, the hip, the knee and the ankle joint. So the depth of the squat is incredibly important. So you want to try and keep your back relatively straight, feet around about hip width apart, squat down nice and deep. Move the pelvis or push the knees open, try and improve the mobility around the ankle joint. And if you struggle with these, with a deep squat and easily dropping down into this deep squat, there are a couple of ways making it a little bit easier. First of all would be to elevate your heel. So I'm using a little 1.5 odd centimeter plank that I put under my heels. Another way is making your stance slightly wider. And then because the focus of this movement is mainly mobility, you can also relax your spine a little bit when dropping down into this deep squat. Whereas with the squat for posture and squat for strength, the orientation of the pelvis and your lower back is incredibly important. But with the squat for mobility, try and just go down deeply, try and open up the knees a little bit, improve your ankle mobility. Try and stay in that position for anything between 10 and 30 seconds. And you can go up and come down 3 to 5 times and use these as pause exercises in between long hours of sitting during the day. Alright, so when you're in the deep or sit squat position, you can try and open up your hips a little bit because we're squatting for mobility. So you can try and open up the hips slightly and also improve the mobility of the ankle joint. Try and straighten up your spine if you can in the deep squat position. So yeah, so squatting down deep is made significantly easier by having a slightly elevated heel and slightly wider stance, feet a little bit externally rotated. It's easier to keep your back upright. Again, you can try and open up the hips slightly, shift your weight over the forefoot to try and improve the mobility around the ankle joint. Alright, so when squatting for posture, the focus changes to the quality of the movement. So here, the form of your pelvic orientation is incredibly important. And pelvic orientation has a massive effect on your posture as a whole, because if your pelvis is tilted forward, there's a lot of automatic unloading of the shoulders and the scapular region that takes place. So tilting your pelvis forwards or anteriorly, as we say, is very important when squatting for posture. I do an overhead squat and I try and do it around about 30 to 40 centimeters away from the wall because it forces me to try and stay upright while dropping down into this overhead squat. You should feel your lower back and your trapezius, the muscles at the back working quite hard to not drop forward and actually touch the wall. Again, if you struggle going down relatively deep with this squat for posture, it can be made easier by again elevating your heel, making your stance slightly wider, and maybe just not dropping quite as deep as the full depth of the squat that we did for mobility. So when I squat for strength, it's with the squat obviously you strengthen the hips, the quadriceps muscles, so there's the big mover muscles really work hard with a squat with weights, and because of that, again, the form of the movement is incredibly important. So again, roll the pelvis forwards or anteriorly. It's basically like pushing your bum out slightly, but the rotation should really be around the pelvic area and not trying to arch your back. When you've got your weight on your shoulders, you could also use dumbbells or a kettlebell, but I prefer using weight on the shoulders because it improves your posture while squatting. You should only go down as deep as you can without compromising your pelvic orientation and arching your back or cheating with your back. So you can do a quarter squat, which is quite functional, especially for running injuries and, in our case, trying to solve some chronic injuries and just making you that little bit stronger. If you want to squat down a little bit deeper, again, you can elevate the heel, slightly widen your stance. When you squat with weight, you don't want to widen your stance too much, because it has an effect on the muscles that actually help you with this movement. And then try and stop yourself at the point where you feel like you've still got control of the pelvis and the back staying upright, and then from there push straight up. So make sure that you don't rock in that position or that your bum lifts before you actually bring your upper body upwards. When squatting for strength, it's quite important to rather not do it more than twice a week. You can, if you feel like you can do a little bit more or go a little bit heavier, I'd rather do that and do it once or twice a week than try and squat for strength every day. Whereas squatting for mobility or squatting for posture is something that you can do every day in between hours of sitting to fight the effects of stiffness and compromised posture related to sitting. So there are just 4 easy ways that I try and sometimes warm up for an actual squat. So the one is using a stick, like a broomstick, for shoulder mobility. I call these exercises shoulder dislocations. Please don't dislocate your shoulders. You could also use an elastic while performing the movement. You can just do 5 to 10 repetitions of these shoulder dislocations. The other one is to try and open up your thoracic spine. So just lying over on a foam roller, slowly extending your thoracic spine just for 5 to 10 seconds, maybe do 5 repetitions, slowly extending the thoracic spine. The third one is an exercise I call bear walk, because my daughter says it looks like I'm walking like a bear, but it's basically like a dynamic downward dog from yoga. And then finally is ankle mobility. Ankle mobility has a huge effect on the depth of your squat. So I'm going to show you just in like a lunge position how you can try and slowly go backwards and forwards over the ankle joint to improve ankle mobility.